Hi, I'm Dave O'Shaughnessy. I'm the EMEA Healthcare Practice Lead for Avaya. I'm here at the wonderful Gitex show in Dubai 2016. I want to give you a demonstration of some of the smart technology that we've developed specifically for health, well, around healthcare and a number of verticals really. It can be adapted to retail, government, etc. And it's all about omni-channel engagement between, in this case, a patient, could be a customer, and also with an agent. But really so impressive the way we bring together multiple technologies in this engagement. So we created an app, and this is a digital healthcare app, so a patient will log in, they give their authentication to make sure that the contact center agent knows who they are. So this is an app they would download from a store specific to the hospital or healthcare service that they provide. So as you can see on the app, I have a lot of different information like profile, patient, results, payments, etc., etc. But in this case, I want to actually initiate a collaboration or a discussion with a skilled person within the healthcare network that I'm subscribing with. So I'm going to initiate a video call from here, and that's going to open up for the agent an alert here. I'm going to pretend I'm the agent up here. So when I click on that, I've opened up already a point-to-point video call between myself and the agent. So that'd be more preferable if you think from a patient perspective than having to go into a hospital, park, the time, waiting, consultation. Isn't it great if I'm able to do this through modern technology like on an iPhone, an iPad, or just a smart device, be able to initiate? So that's my point-to-point video collaboration. Let's create a scenario where the patient wants to have some more information about certain healthcare services. Normally, the patient might say, "Can you give me a website for that, or send me a document on email?" And the patient, in this case, the skilled agent is going to say, "Wait a minute, customer, Mr. Customer, I'm going to actually share some content with you in the session, in the actual app." So we go in here to web collaboration. We start that session straight away. I can see that on my iPad. So as the patient, I'm seeing all this information, or this interface come up. So I'm going to, first of all, share a document with the patient. So this could be information on other procedures, on other activities and so on. So you can see this comes up in the iPad, so the patient doesn't have to go to a website, it's automatically being brought up. Another cool thing that we can do here in the collaboration is that the agent can now do some highlighting. So Mr. Customer, I want you to check out this particular part of the document that I've shared with you, and that comes up also on the iPad app as well. Now, let's say the patient goes, "That's really interesting, I'd really like to buy this service or subscribe to this service," or whatever. The agent could go, "Okay, well, there's a website where you can fill out more information. Would you like that?" And the patient goes, again, they'll say, "Okay, give me the URL and I'll go to it myself." And the agent goes, "Actually, hold on, I'm going to share with you a web page." So you go down here, we push a web page, and as you can see, the web page comes up here. It also comes up for the agent as well. Really cool engagement, all happening with the single agent. So the agent goes, "Okay, as you can see here, there's a web page with a lot of information that you can fill out for this particular service." Then the patient goes, "Yeah, a lot of information in there, you know, I don't know how to fill out." So what does the agent say? Again, hold on, I'm going to be able to take over your session. So I'm going to request control. There's a request control button up here. When I click on that, down here you'll see on the iPad that it's requesting that the patient allow the person to be able to take control. So you can see here, it's pretty cool. I can put in all the information about the patient. All this good information. You'll also see here, some of the fields are actually blanked out. Credit card number and social security number. For security purposes, that's a smart idea. Only the patient or only the client will be able to put that information in here. So really good engagement between the agent and the patient all within the app. Now finally, I can also say, let's imagine that the patient then says, "Listen, I'm afraid I have to drop this call. It's been fantastic. You've shared content with me. You've shared a web page. We've had the point-to-point video call. By the way, that video call is still going on there in the background." But the patient says, "Listen, I've got to leave. I've got to go," or the customer, whatever. "So I'm going to have to end this call." The agent says, "By the way, you see that QR code up in the corner? Just tap on that, please. And if you've got a QR code reader on your smartphone, let's bring it up. I'm going to scan that QR code. And what does it do? It's going to set up a point-to-point video call between myself and the agent. Now I can go off to my train, I can go off to my other venue with this point-to-point video call. One of the other nice features is, what if the agent says, can you share me a picture, or can you share me an image of what's actually happening, the cut or the product or whatever particular vertical we're talking about here. So with this interface, we can go into the collaboration on the iPad. We can click on the button to either take a photo, a video, or choose from the photos. So I'm going to choose one of the previous photos here for my camera roll. I'm going to accept that one. Let's just share that. So that comes up there, and it also comes up here with the agent. So the agent can click on that, and they can see the image, and they can do a diagnosis, or they can see the product, or maybe insurance. Think of all the verticals that this could be applied to. We're using WebRTC, a snap-in, the mobile video snap-in on the Breeze, and that is basically what we're using here. And a lot of the technology that you've seen here is using the Avaya Breeze technology, the mobile video snap-in, the collaboration, etc., to create this really omni-channel engagement between patient, client, and an agent. Thanks very much.